kinds of these are Holmens. And you put them in naturally fingers and toes, feet cases. So you hook this underneath the bone, right? Underneath your structure. And then this holds the tissue back. And your bone is then leveraged, right? It allows you to pull against it. So when you pull against this, you can hold it easier rather than trying to hold it this way, because then your tractors slide out easier. So this actually slides underneath the bone, and then you can pull back. Okay? Bigger, lots wider. You're going to see a lot of variations of these. Lots of variations. Next are Reg Nails, used on hands and finger cases. Great for grabbing the tendon and pulling it over without damaging it. You don't have that cat's paw at the end to worry about, right? Okay. So a lot of hands and fingers. These come in different sizes also. A lot of people like these for fine dissection. And these are Jorgensen's. Excuse me, tenotomies. Okay, what does it sound like? Tenotomies? Tendons. Okay, so a lot of times using dissections on hands, you can dissect out the nerve that's around, the tendons away from each other. You've got tons and tons of tendons in your hands and in your wrist area. They're one on top of the other. And it's pretty interesting when they do these. They'll do these hand cases and they want to identify which tendon it is for sure. So they've dissected it out, because you can see all your tendons that are here, right? They dissect them out. They'll take one and pull it, and then that moves that finger. Then they know which tendon it is. And they literally pull it pretty hard, and the finger will come all the way back. Okay? So they will identify each tendon before they cut it, or they want to, some of them you can do without, and those are identified, and they want one of those to then take it and move it to someplace else. Okay? Have you ever seen that on the schedule where they replace your joint in your thumb? Okay? That's what they use as a tendon, as a spacer. They'll take a tendon out of here, roll it up in a ball, sew it together, and then take the bone out that has the severe arthritis in it, because then the person can no longer use their thumbs. Put that spacer in there, that little bone that's right in there. They put this, okay, just what it says. They love to measure things, okay? On the other side, you can actually tell what size, okay? If you don't know what size drill bit you know, you can actually measure it, okay? Most of the Cincy sets come already marked for you. The older ones did not, okay? But if you get one of those older ones and you don't know what size it is because they're all mixed up, then you can find out what it is by this, okay? Elevators. These are called periosteal elevators. That's their last name, okay? They all have first names. This is a small cob, large cob, T, and freer elevator, okay? Every service uses a freer elevator. Every service. ENT to general to plastics. So this is definitely one you want to know. You'll notice one end is sharper and one end is duller. Okay, so they can use sharper blunt. Endarterectomy that you're going to be doing soon, they can use this to take out the plaque around the artery. Okay? And a lot of them will use that. So what is your periosteum?
The layer, the external layer on the bone.
Okay, it's clear. You can't really see it until you scrape it off. Okay, it's thinner than peritoneum as far as being what you can actually see. You can see it when they scrape it off, but it contains nerve and nourishments and small little vessels.